This exercise is performed in a standing position. Use your non-operative arm to stabilize yourself on a counter or the back of a chair. Bend slightly at your waist, feet shoulder width apart, and allow your surgical arm to fall forward. Focus on turning off the muscles in your surgical arm and allow gravity to move your arm. While keeping your muscles turned off, begin shifting your weight back and forth over your feet, going side to side. This is a gentle exercise. You will not see a lot of movement in your arm. Repeat 10 times. Now shift your feet so that one foot is in front of the other. It doesn't matter which foot is in front. Begin to shift your weight forwards and backwards with your arm muscles still turned off. Repeat this exercise 10 times, 3 times a day.